It's supposed to be 10% softer, it's lower than the other one, 10%. 10%
Since next week is going to be 8 deck in here. So you're not 27.
Okay. So
Following next week is going to be 8 deck.
don't press the trigger yet.
No.
Yeah, unless
More focusing on the medical. Yeah, or medical.
Adjust it properly. Don't forget there's a bit of a gap there. Don't touch that. Wait. You can go from here.
so this is 30% lower pressure hour.
37%.
37%.
30, so nearly 40%.
Nearly 40%.
Yes.
So it's like way half.
Yes.
Way half. Yes, the same. Way half the other one.
Yes. So firmly push the yellow. Okay. Now open up. Okay. I want you to talk through what you're doing.
Of course. Yes.
So tell me when you're ready, and I need to make a video in order so I can send it to everybody.
Of course.
20 seconds. So get into first. Before we do that, don't inject it. Find your position first.
Yes.
How are you going to do it?
Okay. You open up wide, please. Yes. Now we are going to inject in this area. Okay.
Yes.
This one.
Where?
Okay. Just between the
15.
first and second femur.
You're not gonna go. Okay.
No.
No. We're
Just
talking about.
in
No,
this area?
I'm talking about 1 and 2.
1 and 2 area.
Yes, because that's the most.
Painful.
Yes. The
Yes.
most painful injection.
Okay.
Now that's the hardest. I want the hardest part of the palate.
Well, you can go for the incisor region.
Okay.
Okay, in the palate.
Okay.
Fine.
Orthodontist, when they do adjustments, where would they inject?
Orthodontist.
Orthodontics, they are not used. They are not.
When you do adjustment, clicks. When you do adjust on the screws.
You mean the implants,
Yes,
small implants,
yes,
mini implants?
yes.
Well, yes.
You put 0.05, 10.
Nothing, just drops.
Okay.
will do.
Where is the most painful, the most difficult palatal injection?
It's here.
The one that
Yeah.
dentist threads
Yeah.
hates.
But if you want to go for the incisive foramina here,
The one so you can do like a full block as we discussed yesterday.
no, it doesn't go like that.
Okay.
This incisive foramina, it just gives paresthesia from the central incisor
Yes.
to the second premolar area.
What
Okay?
makes the dentist's life easier? Palatal, from a palatal point of view.
Well, if you want to inject here, you should inject a little bit here, just a few drops. That's a trick. So it does get parasitized here in this area,
yes.
and then you do inject in this area to get the whole
Simple palate. Go palate.
But
Yellow.
if you want to inject really in that area, how much do you have?
0.1.
No, we need a little bit more, less than that in the
Point-
interior area first.
Okay, no
Here.
worry about it. Just go there. We'll do it later, after.
Okay.
And then you can do it.
We do
Sorry.
position it.
Tell me when to start.
Yeah, you can start now. Okay.
Ready? I want you to talk through
Okay,
your
now
injection.
we are going to position this one. I have chosen the 45 degrees, so it just goes directly to the palate like that.
Yes.
Okay. Open
Support
please,
it.
wisely. Okay. I'm not gonna shoot unless I tell you. Okay. Open please.
Don't tell her. Give anxiety.
Yes,
Okay,
like
you
that.
support it with your finger.
Yes.
Your thumb on the.
Yes. And you just push it to create a pressure space.
Yes.
Okay. And you just press the button when you're ready. Are you ready for that?
Yes, ready.
Okay. Open wide please. And that's it. You can see here the blanching of the tissues, and you can see where the injection entered. You see that? That small bleeding point? That's where the injection fluid, the anesthesia, just entered inside the incisive foramina. And the incisive nerve is
Would you call
parasitized.
this a successful injection?
Of course, because I can see the bleeding, and the spot is very right. You know,
Okay.
it's just in the incisive.
Okay.
My friend, tell me something, okay? Push this one.
Both. The same time. Yes.
You want to tilt a bit?
Tilting, huh?
Tilt is this. More.
Yeah, a little bit.
Okay. You do
Yeah.
the also, you can do editing, I'll do the focusing.
It's okay.
All right, now, so we are targeting here the incisive.
Just a second.
Yeah.
Just video. 3, 2, 1, go.
يلا شغال.
Okay, now we are targeting the incisive nerve, which is located just palatal to the central incisors, upper central incisors. Okay,
Using the medium strength.
this is the medium strength still, okay, which is supposed to be 37% lower
10% lower
pressure power.
than the normal. Yes.
Okay, excellent. So I prefer to use here the 45 degrees as to place this. Open up like this on the palate directly, but still we have a limited mouth opening. So if you use the flat one, it's never going to be in place. You know? So if you just tilt it.
So positioning of positioning.
The positioning is very important.
Very important.
So at this
Yeah.
point, I prefer the supine position.
Yes, supine position is recommended for all needle for injections.
Excellent. Now we have a better.
Yes.
Now, as I'm placing this, the 45 degrees, the back should be resting on the palate posteriorly, and anteriorly we have the
Short angle.
short angle.
The short side.
Yes. And
Support it with the finger.
yes, we have to push to create a pressure chamber.
Yes. Yes.
Okay.
Definitely.
And you just put your finger here on the central,
Yes.
and other finger on the back of the silicone
Thumb on
tip.
the top, on the two front
Yeah.
teeth. Index finger holding the syringe.
Okay, and now we are making sure we're in the right spot. And are you ready?
Go for it.
1, 2, 3. Excellent. We have some blanching in the tissues here, but still we have leakage.
It's splashed everywhere.
Yeah,
Splashed everywhere.
yeah, a little bit.
A bit more. Just a second. Ready? Steady. Ready to open up lid? Okay.
So we are targeting here the incisive nerve, which is located just palatal to the two upper central incisors. Okay. Okay, this is the full power, right?
Yeah.
Yeah.
Normal strength injector.
Open up his finger, please. Now we are going to support with our thumb here back. Yes. The angle is supposed to work.
Yes.
Okay. Now I'm supporting with my thumb here, and with my thumb here, okay, and the other finger in the back.
Apply pressure.
Yes, the pressure is so deep, and we are ready when you're ready. Okay, 3, 2, 1. See the blanching? It's there. See that?
Okay.
See that spot? It's
Yeah.
white. It's blanching.
Okay.
So,
So
typically, you're not always going to get blood drops somewhere. Did you feel like something sting you in the back, right? That's it. It's it.
Okay.
So, technically, بدأت أوصل? Technically, you should like use your thumb here. The most important is positioning the small hole here, okay, on the incisive foramina. You can see it's bleeding here. Can you? Right? It's bleeding a little bit.
yes. Can you move
Right?
your finger?
Yeah. See that?
Yeah. Yes.
There's the blood. You can see my finger here.
Yeah.
See my finger?
Yes.
There's a
Okay.
small
No.
blood. Now, the most important, in my point of view, now you have to place it just parallel to the hole inside, just above
Yes.
it, and you have to press with your finger and your thumb here. So you could create a pressure
Okay.
area where the pressure is going to be very high.
Would you call this a successful palatal injection?
Yes, yes. And if you go like that a little bit, there will be a pressure leakage here. Okay?
So I have to be perpendicular, like I'm
Yes,
advising.
like
Must
that.
Be,
Yes, like
okay,
that.
Two,
And you choose the silicone tip, which is
angles.
angle.
Okay.
If you use the straight one, now you can see here one important thing is that when we place it like this, okay, it's merely pressing against the lower jaw,
Yes.
and you can go
Yes.
no more else.
Okay, so
No more,
positioning,
no more.
just
yes,
positioning.
like that. So there's no way. If you use a straight one, you are not going to have a good shot.
Okay. Thank you.
See? Welcome.
Okay. Now.
Okay, no injection. No injection.
Okay. Practice
Now
first.
I think the best thing is to hold it like a pen grip.
Okay.
You know, the pen grip, which actually in the normal dental anesthesia, we are required to inject.
Then how are you going to use your thumb?
You just slide up and
Yeah,
push.
okay.
But the ideal one in normal injections is the pen grip. It's the one that you can control both like that.
Okay, so we don't inject it, we just practice first positioning.
Yes, yeah, of course.
Practice positioning
Now,
first.
we just want to see, flash please, right, from ahead maybe, yeah, like that. Now, just, no, that's, now, we go like this.
Okay, so tell me, is it too much for you? Painful? Because
the
the sharp, no, you look, you see the wings?
Yeah, it's like tips.
Tip?
You know,
Eyes tip.
you don't push. That's where the second tips make sense. We're learning here.
Rib? Fingers crossed the two. Okay.
Put him in 45.
No straight, no 40.
Now make sure always, you always make sure that the hole is
Aligned.
aligned.
It is. Yes, it is.
Okay, ready?
Now,
Tell me when, and I want to start filming.
no, we just position first. Okay.
Okay, position.
You want to get your hand like that, and
Ready? So I want you to talk through explaining. What
Okay,
you
now
do.
what
Just
we're
to
doing
say-
is that-
say 3, 2, 1, and then explain for mental nerve block or mandible or
Yeah.
anything you want.
well, as you all know, okay, familiar?
أنا بصور.
Okay, now as you all know that we are going to give this mental nerve, okay, which we need to anesthetize the whole region from the second premolar to the central incisor, all this region, okay? So technically the mental nerve is located on a on a just perpendicular line, passing through the pupil of the eye. Can please bring the eye here? Yes, the pupil of the eye, the center, and it's passing down to the second premolar. Okay, so it's a line like that. That's where the mental foramina is located in this area. Now we need to inject, but we need to get like
You need to create
just
a good seal around the hole.
yeah.
Otherwise,
Close a little bit, please. Just
I don't know, to be
thank you
honest,
so much. Now we need to create a good seal like that.
The seal.
Okay,
Yes.
and then
And after you got the seal.
yes, and you see that it's 45 in the sulcus, and that's where you inject.
Okay.
Even if you can go a little bit
Okay.
like parallel a
The
little bit.
video's becoming too long. Let's make it a bit shorter.
Okay.
And just a second. Not yet. Not yet.
Okay.
So,
See that position?
Just a second. Okay. Now you're positioned correctly.
Yes.
Even though we don't have a protective sleeve here.
Yes.
Still, you can see that nothing is touching the injector. It's only her lips are touching only the disposable syringe.
Yes.
We're ready when you are, doctor.
Okay.
Okay. You don't
So,
never count down. You give anxiety
you
to
wanna
the patient.
have a look from a different angle to make
Yeah.
sure you're in the right spot
Yes.
using the right angle,
Yes.
and then
Make sure it's
3.
embedded. Don't count, never count down. Just whenever the dentist is ready. Otherwise, you give anxiety.
You see that?
Yes.
It's there.
Okay. There you
And
go.
the whole fluid is inside.
Okay. Now, normally, okay. Just a second. How does it feel?
It's good. No pain, but the more the kind is
Yeah, a little bit of Teducan should bleed
Okay.
sometimes.
Usually
It's fine.
it's recommended. Usually, after you inject, you rub it in. Remember?
Yeah, of course. Yeah.